No one ever knows what they want to be when they grow up. Our minds are constantly changing. So how does one know what career path to take? Personal experience. There was never a moment in my life when I did not want to help people with my future, but I never knew what I would do with that. As an athlete, I was in and out of physical therapy for various reasons. Soon, I learned that the way the human body was all interconnected, and I wanted to know more. I was able to take some anatomy classes in high school, and I knew that I wanted to keep learning more throughout college. Through my own encounters with physical therapy and the human body, I knew that this was the career path I was meant to follow. There are many benefits to becoming a physical therapist. In order to pursue this career, one must endure schooling, choose a good workplace, and endure the ups and downs. In order to pursue this career path, one must have completed a 4-year BA or BS undergraduate degree before entering any graduate program. The current graduate degree is a doctor in physical therapy. Program lengths can vary from 2.5 years to 4 years, with classwork containing labs and clinicals, and are far more challenging than the undergraduate level. After the degrees are obtained, licensing exams must be taken before beginning one's career. Physical therapy is an ever-changing science. Most people in this career find human anatomy fascinating, and their knowledge allows them to learn more and treat the human body. There is always room for growth, and information on different approaches are being discovered to get the same results with the same treatments. Kelly works in a manual-based clinic where they always have continuing education classes at work. There is a lot of interaction with different types of people. As a physical therapist, you must be a good motivator with good personal skills, but also have good clinical skills so that the patient shows improvement with mobility, decreased pain, and/or increased function. To find commonality with patients, Kelly usually finds topics that they are interested in to discuss during treatment, which makes things a little bit more personal. It is said that teenagers are a hard group to work with. They are so quiet, and you have to drag out things to get them off to communicate with them, and their cell phone is constantly glued to their fingers. While there is much required in the process to becoming a physical therapist, the workplace is also a factor one must consider. Kelly's typical workday is about 8 to 8.5 hours long. The dress code is more casual and usually includes khakis or any form of dress pants and a polo and a nice shirt. Tennis shoes are commonly worn as physical therapists are constantly on their feet, and comfortable footwear is important. It is a rather active job and is not meant for someone who wishes to be stuck at a desk all day. Tasks a PT must complete in addition to their treatment process include a great deal of paperwork such as daily notes, letters to physicians, discharge summaries, and insurance authorizations. There are many specialties in physical therapy falling under 3 categories: acute care, skilled nursing, and outpatient care. Acute care deals with individuals who are admitted to a hospital for short-term patient care reasons such as injury, illness, surgery, accident, or recovery from a trauma. Skilled nursing deals with individuals who are admitted to a facility that typically cares for elderly patients and provides long-term nursing care, rehabilitation, and other services. Outpatient is the most common and deals with individuals in a clinic, office, or other health care facility, primarily to address musculoskeletal and neuromuscular injuries or impairments. Kelly chooses to treat patients with neuromuscular deficits such as MS, Parkinson's disease, and amputees. She also treats patients with joint restrictions and those who need strengthening. She works with neurological patients because she finds them to be challenging and she likes a puzzle. As the workplace offers many elements that seem overwhelming, the benefits of becoming a physical therapist far outweighs them. Being a physical therapist is very secure as we have the baby boomers who are aging and will be in need of physical therapist services. Bigger cities seem to be saturated with physical therapists, but rural areas seem to have problems keeping hold of them. Bigger cities have lower salaries than these rural areas. Being a physical therapist can help you not only grow in your workspace, but as a person. Kelly learned to be flexible and to be able to adjust to see other physical therapist patients. She has become comfortable with the always changing environment and has also learned to be a good time management to complete the necessary paperwork. The most rewarding part of the job is seeing your patients achieve. Kelly loves to see the neurological patients, such as stroke patients, become mobile again and the amputees be able to walk with their prosthesis. She likes her patients to feel proud about the progress they have made. However, it is not all happy times. Some patients may be disappointed in their slow progress or relapses. Physical therapists must be very motivated and see the potential for patients to improve, even if the patient may not give their full potential. An example will be some of the amputees Kelly deals with. Some of them have been without a prosthesis for so long, they find it too difficult, but Kelly must keep them motivated and keep them going forward. She is so driven and she wants to help everyone. However, she is learning that is not possible. The main experiences of a physical therapist have been touched with insights from a licensed physical therapist, Kelly. I hope it provides some perception to those who may be considering a career in this. As discussed, becoming a physical therapist is no easy task. There are many years of schooling, multiple workplace options, and plenty of benefits and drawbacks. At the end of the day, what truly matters is the people you've helped and the lives you've touched. Seeing your patients progress and knowing you had a part in this is benefit enough to pursue this rewarding career.